Welcome to today's video. This is a continuation of our previous video on worst chicken diseases, Newcastle disease. Here we are going to focus on post-mortem results of an infected bird. However, in our previous video, I did not mention to you the external observable signs of an infected bird's head. We are thus going to start from the head to the distal end of the bird in today's video. In case you find some terminologies used not understandable or too scientific, feel free to drop your comment below on what you feel ought to be added or clarified. Thank you. You can as well subscribe to the channel so that you be versed with our future videos. There we go. Sign number 1. The crest is marked edematous and contains multiple hemorrhagic foci. There is an accumulation of excessive amount of watery fluid in cells and tissue of the crest, and thus it appears swollen and flabby at its base. Sign number 2. There is marked hemorrhaging of the crest or comb, chin, and adjacent skin. The crest, chin, and adjacent skin appear to be deep red in color. This is as a result of blood vessels rupture and thus blood escape from the ruptured blood vessels and spreading underneath the skin surface. Sign number 3. Marked hemorrhage of the crest and head with cyanosis of the edge of the crest. There is a bluish cast to the crest periphery, or rather, the edge of the crest is bluish in color. This is caused by low oxygen supply levels of the red blood cells. Sign number 4. Hemorrhages are observed in the lower ocular conjunctiva. The ocular conjunctiva is a part which covers the eye. It appears soaked with blood due to rupture of the blood vessels and escape of the blood. Sign number 5. Conjunctival hemorrhage is more severe in nictitating membrane. Nictitating membrane is the clear membrane that covers the eye, protecting the inner parts from direct contact to the exterior. It thus appears red in color and soaked with blood. Sign number 6. A cross-sectional post-mortem of the pharynx show numerous accumulations of fibrinonecrotic exudate adhere to the foci of necrosis in oral, pharyngeal, and oesophageal mucosa. Fibrinonecrotic exudate is a mass of macrophages, often with lymphocytes and plasma cells that have been seeped out of a blood vessel in an inflammation. Sign number 7. A post-mortem of the trachea shows the tracheal and laryngotracheal mucosa contain numerous hemorrhagic foci and small accumulations of fibrinonecrotic exudate. Again, a mass of macrophages, often with lymphocytes and plasma cells that have been seeped out of blood vessels of an inflammation, but this time round with also blood from burst veins. Sign number 8. A post-mortem of the neck shows there is marked subcutaneous edema in the neck extending to the thoracic inlet. This means there is an excessive collection of watery fluid in the neck, tissues, or cavities. Sign number 9. A post-mortem of the thorax shows serial hyperemic and necrotic tonsillars visible from the serosa. This means there are numerous blood veins visible on the outermost coat of the visceral structure that lies in the body cavity of the thorax. Sign number 10. A post-mortem of the cecal tonsil shows the cecal tonsillar is observed red-brown and necrotic. This means there is an accumulation of pink spots on the tonsillar as a result of a mass of dead cells. Sign number 11. A post-mortem of the mucous membrane shows multiple linear mucosal hemorrhages observed. This means there is presence of hemorrhages in the mucous membrane in a linear manner. Sign number 12. The mucosa is hyperemic and contains hemorrhagic foci. There is numerous blood vessels in the mucous membrane that have been ruptured. Sign number 13. The mucosa contains multiple demarcated foci of hemorrhage and necrosis. There are numerous spots of pink rings as a result of dead cells. Sign number 14. A postmortem of the Proventiculous shows the mucosa of the Proventiculous is eroded and covered with fibrinonecrotic tissue membrane. This means the Proventiculous is the part which stores food in a bud prior proceeding to the gizzard to continue with the digestion process. Its mucous lining is completely eroded. Sign number 15. Necrosis of the cecal tonsil. There are masses of pink deep red markings as a result of dead cells on a local area in the tonsils. Sign number 16. A postmortem of the trachea reveals diphtheria laryngotracheitis. This means there is an inflammation of both the larynx and trachea. This hinders the throat from breathing well and swallowing normal. This is the reason why in part 1 of this video we did mention that gasping as one of the main signs of Newcastle disease. Sign number 17. A postmortem of the intestines shows necrosis is observed in the intestinal mucosa. The intestinal mucous membrane has numerous spots of dead cells. Thus, it forms rings of deep red or pink in color as a result of accumulation of dead cells. By watching this video to the completion, I believe you are in a position to do a postmortem of your bud and diagnose Newcastle disease infection should it be present. Subscribe to this channel and watch a new educative video every week. In our next video, we shall learn on how to control and prevent, if not treat, this disease. Thank you.